And welcome back. We've got our series Today's Checklist. Today we're going to focus on common medications that a lot of us either already take or are going to take them at some point in our lives. Board-certified surgeon Dr. Cedrek McFadden is here breaking down exactly what we use these drugs for, maybe more importantly, how they can be misused. Dr. McFadden, good to see you.
Good morning.
Good to be here. Thank you.
Okay, so the one thing we almost all have taken, antibiotics.
Yes. At some point, you've taken antibiotics, and these are medications that treat infections from bacteria. So they're not treating viral type things from colds or the flu. And it's very important that when you're taking these particular types of medications, that you take the entire course of the medications. Well, it really comes down to the doctor prescribes 5 to 6 days of antibiotics. And that's the amount of time it's going to take to eradicate that bacteria from your body. So even if you're feeling better on day number 2 or 3, if you stop that medication, there could still be bacteria that can allow that infection to recur. So you really want to complete the medication regardless of how you feel throughout the medications. Even if you have some of these side effects, right? I mean, people can have allergic reactions, but the great majority of these reactions are what we call side effects, things like nausea, vomiting, and GI upset. And really the long-term repercussions of overuse of these medications, it really comes down to antibiotic resistance, where the bacteria kind of outsmart the antibiotics, and therefore we have a harder time taking care of patients who may have these types of
Doc, is it true that you're not supposed to drink
alcohol?
Taking alcohol while you're...
Well, it's not even just drink alcohol. It's even like people like to take these medications with milk. Dairy, those types of things, anything that can greatly inhibit the ability of these antibiotics to do what they're intended to do for your body. So it's recommended just water, maybe a little tea or something like that, but just really want that medication to get full effect.
Let's talk about pain meds for a second. And a lot of people worry about dependency issues, obviously.
Yes, so this is a big one here. There's 2 different types. There's non-opioid medications as well as opioids. These are things like acetaminophen, ibuprofen versus the opioids, hydrocodone or oxycodone. And they really have a great purpose. If you ever had surgery, if you ever had a headache, these things can be very helpful in your overall recovery. Here's the key. The bottom line is you want to take the smallest necessary amount for the shortest duration of time. Because people will say, well, I don't want to take it after my surgery because I don't want to get addicted. Well, that's okay that you're taking it for the small amount of time. But the side effects that most people really come down to are the drowsiness and the dizziness. You know, you can't drive with this medication, right? It's against the law, right? And really the overuse of it can lead to dependence and tolerance, where it takes more of that same medication to have the same intended effect. So really, smallest necessary amount for the shortest duration of time.
Makes sense.
Let's talk about heartburn medications, because I feel like you almost have to take it before you even get the heartburn.
Well, some of them you do. And for people who take these medications as needed, meaning they're not only prescriptions, they often find that after eating some spicy foods or going to bed, they're taking some type of antacid. But there's 2 main groups. There's antacids, and there's those that actually reduce the amount of acid that your body makes, like PPIs. These are medications that, again, you may take after meals if you're having symptoms, or if you're having symptoms that are persistent or you have established problems like reflux, your doctor may give them to you to take on a daily basis. So you really want to follow the recommendations of your doctor. Overall, you know, we talk about some of the overuse of these, primarily in older patients who have been using these medications for longer periods of time. So there's some concerns that they could lead to things like fractures, pelvic fractures or spinal fractures, because of the way that that medication reduces the calcium absorption in your stomach. So
how about steroids?
Steroids, right? You've taken them, you've used them, whether it's been a cream for eczema, or perhaps you had a respiratory problem that you needed the steroids. These are medications that help your body reduce inflammation. We also use them in my world for things like Crohn's disease or other autoimmune disorders like lupus. And really the big message here is you don't want to stop these abruptly. You want to finish the entire course.
Why is the whole abruption thing such a problem? Like, why is that?
Because when you're taking these medications, it's called exogenous medications, your body's adrenal gland that normally makes a steroid, it kind of goes on pause. And so if you stop this medication all at once, your body needs to kind of ramp back up. So your doctor is going to give you, especially for longer, higher doses, they're going to give you a tapering before you discontinue it. So you don't want to stop it at once because it can create some really unnecessary and bothersome side effects or withdrawal symptoms from it.
Okay. Finally, can we talk about blood thinners for a moment?
Blood thinners, very common now. I mean, I'm seeing a lot of patients now who perhaps use blood thinners, not just because they've had blood clots, but because they have certain heart conditions or arrhythmias. So they can take these blood thinners. These are some of the ones that you see often, but you can buy just the aspirin over the counter or the Plavix and things like that that you may need a prescription. These, again, prevent clotting, blood clots, et cetera, like that. These are medications you want to take on the same time, generally every day, to make sure it has full effect. But you can bruise really easily. So you have to be very careful when you're taking these medications that you're not falling or even just brushing against the side of the bedpost. You can wake up with the bruise the next day.
Just hitting
it
the
can really
bedpost.
create that, yes.
Okay.
Great
That's
information.
very helpful.
Dr.
Yes.
Thank you so much.
Thank you so much.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.